And South Korea has reported 516 new cases today, which brings the total number to 5,328. The government has taken various measures, including proposing a budget of nearly $10 billion to battle the virus and minimize the economic fallout. Earlier, Tony Chang gave us more details.
I think the first priority is getting more hospital beds, particularly in Daegu, the area that's been hardest hit. 3/4 of South Korea's positive tests have been recorded in that city, and we understand there are 2,300 people who don't have hospital beds yet. Now, some of those people are not in serious conditions. We understand a couple of days ago the local government opened up a center where people can go who aren't showing serious medical conditions, but they can be isolated from the general population. But they are also trying to increase the number of beds, particularly given the high number of positive tests they're now recording. More than 500 positive tests shown this morning alone. So it is becoming an increasing problem. There are severe pressures being put on the healthcare system down there, and I think the government wants to make sure that it is ready. But there are going to be other measures put in place. Those economic measures, you mentioned 3 trillion won added by the government as an emergency fund to fight this. Some of that will go to those emergency relief measures, to healthcare, to trying to provide more masks, and the president apologized for the fact there has been a shortage of face masks, but there are going to be much longer term economic impacts felt too. We were speaking to a businessman yesterday who said his business has dropped by about 90% just in the last week alone. So I think a lot of that is going to be allocated to bring some relief for those people.